Another question what I wanted to ask, aftercare, because different technicians give very different aftercare recommendations. Even in my practice, in my studio, different technicians were giving different aftercare recommendations, and some of the clients were confused. Can you water it? Do you have to cream? Can you wash it or not to touch with the water? So, by the dermatologist's point of view, what is the best way to do the aftercare? Because for permanent makeup, we do not recommend to moisturize or watering the scalp because we use sometimes in non-organic colors, minerals, which are afraid of water if you so that's the reason why we do not recommend to go to sauna or even wash your face regularly like we do. But some of the technicians does the completely opposite. You have to wash with the soap and something like that. So what is the best recommendation, let's say specifically for permanent makeup, taking into consideration that these pigments can be inorganic, mineral, and yes.
Well, I have to say that I don't have the experience specifically for the tattoo healing for permanent makeup. I know it better for the regular tattoos.
Yes. Okay, but for the regular tattoos, okay, let's start with
that. If we do first for the regular tattoos and then I answer to your question, you have three techniques depending on the tattooist habits. When you get the tattooist is going to put a film, like a plastic film, and the plastic film you will keep it from one evening to a couple of days. It depends on the tattooist.
But why? The film protects from the germs and from the dirt?
It's because the tattoo is going to secrete a bit still after the tattooing, the lymph and the debris, so you have to protect it a bit. But why half a day and why 1, 2, 3 days? There is no rationale. It's really according to the habits of the tattooist. Then you will take it off, and you will indeed wash with water and soap 2 to 3 times a day, and you will apply a cream which will be a moisturizer. Usually it's quite fat, 1 to 2 a day, according to how the tattoo look and your daily life activity.
But the composition of this cream should be... Because a lot of use bepanthen, for example. Yes. Is it all right? Because is it like a medical cream with some options to heal, and maybe it will be, the bepanthen maybe won't like the color, the pigment, no? Or it's...
in theory, these creams have to be put a few days after the tattoo, officially. Because it's a wound, the tattoo, and those creams are not intended officially to be put on wounds, but in practice, people apply it almost immediately, and no one has ever, and if there was any fading due to that, we would know about it, the tattooist would know, and the tattooist would have adapted. So there is no reason to believe that Bepanthen, which is a brand, or other cream of the same type that you can find on the pharmacy can have an effect on the quality of the color. I don't believe that.
Okay.
And then you do this treatment until it heals, and it's between 2 to 3, 4 weeks, according to the drawing and how intense it has been done. That's the first technique. The second technique, which is getting very trendy, but I don't think you can do it in permanent makeup, is that the tattooist is going to apply some kind of film, which is adhesive.
Yes, and we saw that.
And that you can keep it for 2, 3, 4, 5 days without touching it. It's waterproof.
And breathing.
Yeah, yes, it's breathing, so you can leave, and it's great, because if you like to dress well, you don't ruin anything. And myself, I've been using it, and I've been pushing to 5 to 7 days. And it's incredible, because when you take it off, nothing happened.
And very comfortable for...
Yes. And then it's done. It looks at least mainly done. third technique that some tattooists like, it's called dry healing. It's completely the opposite. They say don't do anything, wash a bit with water, but let it like that. But then it starts to crust. So I think it's a bit not very nice because it can be itchy, it can be dry, and they don't like it. But that's the three techniques. Now, none of the three techniques have been compared. So no one can say which one is better. And that's why every tattooist has his different technique. And I usually say in my lectures to everyone that basically do what the tattooist tells you to do. The tattooist that did this tattoo will tell you to do it like that. Basically, you can do it. If the tattooist is not is giving you indication, you have to follow what he's telling you. So now we bounce back on the question for the permanent makeup artist. I think you have to follow what the permanent artist that has done the work is going to suggest. Because it can be confusing if they change between artists. But then if you just did it, I think you have to say, well, that's how I do it. That's how I've been doing it. Maybe my colleague does it like that and it works fine, but me, I feel more confident in doing it like that. Because nowadays, no one can tell you that washing the face is going to be a problem or not. It's true that we usually say for tattoos that you should avoid manipulating and touching it all the time. So of course I can understand that if you are there, it's a bit different because you're always touching it. So that could be an explanation where you say you don't want them to touch it. But again, I think that it's your technique of healing that works and you've been satisfied by experience. There's no reason to suddenly dismiss it because someone thinks that it's going to be different. And as regards tattoo healing creams, because there are some creams that say that they can accelerate healing, we never studied we never make studies that has assessed that one cream was more efficient for that or not. So technically you can take the cream you prefer, very thick if you like it, or very thin if you want to have very thin. But it's very thin, you will have to put it more often than the greasy one.
Do you think there is the difference in healing if you implant non-organic or organic pigment?
I don't think so, but it's my opinion. Because I never studied the healing according to ink. Maybe that should be done to show it.
Are there any difference in recommendation for aftercare for the people with different skin color, with different skin thickness, with a different skin if it's oily or dry? You wouldn't change anything.
No,
so
exactly
the same,
irrespective of the skin tone.